old records. You need to make graphs of each investigation. So the first consultation should always be higher. Because you cannot consider a first consultation and second consultation as the same one. And remember, 90% of the patients may not come back to you for a second consultation. If they're coming only for a second opinion, they will not come to you for a second consultation. So your first consultation has to be a final consultation. Therefore, you need to go through in great details from that point of view. Yes. Never. Never. There cannot be more than 3 or 4 or 5% variation in labs. 1. 2. To avoid that, insist investigation from the same lab. Insist with the same lab. There can be a variation of 0.3 in creatinine. Every investigation, you must know what are the normal variations. In creatinine, the variation can be not more than 0.3. If there is a variation of more than 0.3, it's abnormal. You must know the percentage of lab error. Ask your lab, what is your percentage of lab error? And count that into picture. For example, if the creatinine is 0.6, if the report has come to 0.9, it may be a lab error. Up to 0.3, there can be a variation. From 0.6 to 1, irrespective of the laboratory, it's abnormal. So in every investigation, we need to know percentage of lab error. But you cannot have a fasting sugar of 60 becoming 90 as a lab error. It cannot. It cannot. You should be able to pick up minor changes every year if there is a graph. See, if your graph is 60, 62, 65, 69, then errors are gone. Yes, not in 1 year. Not in 1 year. Over a period of 5 years, you should be able to predict diseases. This is called medical astrology. This is called medical astrology. You should be able to say, तेरे को 5 साल के बाद diabetes होने वाली है. तेरे को 5 साल के बाद में cholesterol आने वाला है. You should be able to predict by velocity graph. Calculate the graph with the same, take a scale and calculate the graph and see at what years it is going to cross 80. And it will happen. You should be able to predict. This is scientific medical astrology. Astrology is actually not astrology, it's a science, but patient बोलेगा astrology है, तो डॉक्टर साहब ने predict किया था. It's a science. Okay, now we come back to, we have another 2 minutes. Let me just summarize the new parameters for prevention of heart attack. I always narrate it with the formula of 8080. This is to summarize the formula of 80 for prevention of coronary artery disease, obesity, metabolic syndrome, diabetes, osteoporosis, cancers in India. And the formula of 80 says, if you want to live more than 80, follow the formula of 80. Keep your fasting sugar lower than 80. Keep your bad LDL cholesterol lower than 80. Keep your pulse rate lower than 80. Keep your lower blood pressure lower than 80. Keep your abdominal circumference lower than 80. There can be a variation of some percentage. There can be a variation of some percentage, but keep it lower than 80. To do that, walk 80 minutes a day at the speed of 80 steps per minute. Walk 80 minutes a day at a speed of 80 steps per minute. Do 80 pranayams a day. Eat less, not more than 80 grams or 80 ml of calorie-filled food at one go. The food which has calories should not be more than 80 grams in one go. But that will be 80 into 6, 480 calories. Your one meal should not be more than 480 calories. 1 gram of food contains average 6 calories. 4 carbohydrate, 4 protein, 9 fat, average 6 calories. I'm not talking about water. I'm talking about food with calories. Should not be more than 80 grams. That means your calorie content should not be more than 480 calories in each meal. Again, the formula of 80. Do not take alcohol if you take not more than 80 ml in one day. And not more than 80 grams in 1 week. When you are exercising, you must exercise to achieve 80% of your target heart rate. Do not smoke. If you smoke, you will end up in paying 80,000 rupees as a hospital bill. This is the formula of 80. No way to remember. There is no way. There is simple thing to remember. Everything make it less than 80 or do 80. अब मेरा लेक्चर खत्म होगा, तालियां कितनी बजाओगे? 80 बार. Everywhere do it 80. If you do it 80, it's very simple because otherwise it's very difficult to remember. It's very difficult to remember. कितना cholesterol, कितना ये, कितना वो. It's so simple. Everything. Actual में it is not 80. Actual में cholesterol is 70, sugar is 90. We have averaged out to 80. Abdominal circumference is 85. But to make it a matter of convenience, we have created 80 plus minus 8%. So you are through. You are through. So if it is around 80, you are through. This is called formula of 80. Again, I have created it. I created it in the year 2009. Again, dedicated to the year 2009. Any food item which we should not take every day is more important. And that is चीनी, चावल, मैदा, वनस्पति. ये 4 आइटम आपको छोड़ने चाहिए every day. चीनी, चावल, मैदा, वनस्पति. 2, mix of 7 colors and 6 tastes. When you're taking a salad, make sure लाल भी है, पीला भी है, हरा भी है, काला भी है. ये काला अंगूर ले लिया, हरा सैलेड ले लिया, लाल चुकंदर ले लिया, टमाटर ले लिया. Have a mix of 7 colors and 6 tastes. More of raw food. You have to be very careful when you're taking raw food in India. For NCC, neocystic sarcosis, you have to be very, very, very careful. It is washed properly. If it is not washed properly, you will end up into neurocystic sarcosis. The raw food terminology comes from the West. In India, I cannot recommend where hygiene is not proper. I cannot recommend at a village level the raw cow unless it is hygienically, properly washed. You can take fruits. Best fruit to take is जिसको छील सकते हो, केला and संतरा. सारी गंदगी उसके छिलके में निकल गई. And vegetables have to be washed. If they cannot be washed, don't take them. Ordinary water, they have to be properly washed. Sprouts are good. They can be taken without any problem. Fast food is best for the health. This is the last answer. Fast food is very good for the health, provided you know what fast food is. The fast food is called जो ready-made हो. दूध निकाला, पी लिया. बादाम निकाले, खा लिए. संतरा छीला, खा लिया. केला छीला, खा लिया. अखरोट तोड़ा, खा लिया. This is fast food. बाकी सारा junk food है. So there is a difference between a fast food and a junk food. Junk food is artificially fast food. That is